This presentation is brought to you by TitanWell's Alcohol, Marijuana, and Other Drugs team at California State University, Fullerton. This presentation will focus on other drugs, including nicotine, prescription stimulants, cocaine, steroids, and opioids. There is a separate presentation posted that focuses on marijuana, so we will not be discussing that topic here today. First, we're going to be talking about nicotine. This is a stimulant that is found naturally in tobacco. It is present in cigarettes, vapes, cigars, and hookahs. This drug was very popularized in the 1920s, especially through TV commercials, but the dangers of smoking began to emerge in the 1950s. We did begin to see a significant decline in nicotine use, but addiction rates are higher now with Juuls emerging. More people in the United States are addicted to nicotine than any other drug. When an individual uses nicotine, the drug is easily absorbed into the blood, which immediately stimulates an adrenaline release. It also stimulates the central nervous system and increases blood pressure, breathing, and heart rate. Listed here are common withdrawal symptoms that are linked to nicotine. Withdrawal symptoms are those that occur as a result of the process of stopping the use of an addictive drug. When one stops using nicotine, a few common withdrawal symptoms include feeling irritable, angry, or anxious, having trouble thinking, craving tobacco products, and feeling more hungry than usual. Now let's move on to prescription stimulants. These are primarily prescribed by a physician to patients who are suffering from attention deficit hyperactivity disorder, also known as ADHD, or those with narcolepsy, which is when a person has uncontrollable episodes of deep sleep and overwhelming daytime drowsiness. Some familiar prescription stimulants that you may have heard of are Adderall, Ritalin, Dexedrine, and Concerta. These drugs increase alertness, attention, and energy. Though common side effects include arrhythmia, which is an irregular heartbeat, heart failure, and seizures. A few common withdrawal symptoms linked to prescription stimulants are sleeping issues, depression, and fatigue. The key word here is prescription, so one should be consulting with a physician prior to use. Next, we have cocaine, which is another type of stimulant drug. It is made from cocoa plant leaves that are native to South America and looks like a fine white crystal powder. Street dealers often mix this substance with cornstarch or flour in order to increase profits. They may also mix it with other dangerous drugs such as fentanyl or amphetamines, which is associated with increased overdose deaths. When one gets high off of cocaine, they experience feelings such as euphoria, a rush, and an increase in confidence. But the high does not last long and is short-lived. Users may experience exhaustion, depression, or anxiety after the high. Withdrawal symptoms related to cocaine use are predominantly psychological, so people often use more in order to avoid those symptoms. Now we'll move on to steroids, which are prescribed for those who are suffering from hormonal imbalances or muscular atrophy. When we hear the word steroids, many of us probably think of individuals who abuse them in order to improve physical performance or appearance. Side effects include paranoia, delirium, irritability, impaired judgment, swelling of the hands or feet, severe acne, and liver, kidney, or heart issues. Common withdrawal symptoms include sleeping issues, fatigue, decreased sex drive, loss of appetite, restlessness, and steroid cravings. The last drug we'll be discussing today is opioids, which are prescribed to treat chronic pain. Common opioids include heroin, codeine, fentanyl, morphine, oxycodone, and methadone. Opioids are commonly linked to overdose and death. Some of you may be familiar with the ongoing opioid epidemic due to the significant number of overdoses. The effects of opioid use include euphoria, slowed breathing, constipation, confusion, nausea, and drowsiness. When one stops using opioids, the common withdrawal symptoms can be extremely uncomfortable, making it difficult for many to stop use. Withdrawal symptoms include bone and muscle pain, sleeping issues, diarrhea, vomiting, severe cravings, and uncontrollable leg movements. For more information on drugs that we did not cover in this presentation, feel free to look up drug facts through the National Institute on Drug Abuse. The Student Wellness Center is an on-campus resource. Please visit the website or call the number provided to learn more about the services offered. Also, feel free to follow our Instagram at TitanWell. Thank you.